day because you only want to crust if you have like active skin breakdown. But I'll show you all that. Yeah, this looks great. Look.
It don't look as big as I thought it was.
Yeah, no, this is great.
Mm-hmm.
Okay.
Look at him, he's a trooper. He just
He could not care less.
Okay.
I know. The first time I met Maddie, I slept through the whole thing.
He sure did. Wait, you slept through the second thing too. I think this is the first time that I've seen you with eyes open. Not even playing.
And this is at. Will that come?
I was gonna give
as
you
an
guys
order?
that bottle, yeah. And sorry, my hair, goodness. Vosh is also available on Amazon. Yeah. But
Okay.
put that in your bag or something, otherwise the nurses will get hold of it and take it. Yeah. Vosh is also safe around a stoma and on a stoma. And I like to do that too because stomas are very susceptible to skin breakdown and not necessarily infection, but like coexisting like small bacterial or like fungal infections. And Vosh has activity against funguses and those bacteria. So I definitely like to clean my peristomal area, which peri as in around, and then stomal as in the stoma, with the Vosh after I've like, mechanically wiped up all the poo.
Mm-hmm. So is the lighter skin around the stoma going to heal up too? And dark. I'm sorry.
It may or may not, but this is not something, this is not open or wounded skin,
Okay.
It's
just light.
Yeah, and that can happen when we have some sort of surgical intervention and the skin is trying to heal. We're gonna get, yeah. So I'm just gonna rest it on there. We don't need to do like a total Vosh soak or anything, but just while we're working on other
But
things.
you did put the Vosh in the scar wound as well, the long scar. Okay.
Yes. I am.
oh, okay. I just stepped on the back of it.
I also found some mini scissors. So in the sample kit sent, they should have mini scissors, but I wanted to give you guys these ones too.
Thank you.
Also available on Amazon, and they make cutting pouches way easier if you have the mini scissors that are like slightly curved because you're gonna be cutting a circle.
Okay.
Yeah. Okay. Let me figure out what I might address that big midline wound first and address up our stoma. Because we're gonna use some silver nitrate on it.
On the midline?
Yeah. Okay. And we'll get some pictures. We're in 716 right now, right? Yeah, okay. Sorry, I go to everywhere in the hospital, and sometimes I'm like, what floor am I on?
It smells like bleach.
That's the hypochlorous acid.
Mhm.
Yes. Yeah, but it is not bleached, and that's a good thing because we do have bleach wound cleansers, and they were very.
Do you?
That's
do.
what I was wondering too.
Yeah,
I think
it's
I
called
see something, I was like,
Dakin's.
what is that about?
Yeah, they used to be very, very common, and they still are. Like, there's still a place for Dakin's in wound care.
Does that not hurt?
I've never had a patient tell me that it hurt. Maybe like a little initial sting,
But-
but it's not pure bleach.
What type of wounds do those go on? Like
The smelly, dirty ones. So,
Okay.
like, I used to work in an acute care facility, and I would get some crazy wounds, like big tunneling wound, pressure injuries on butts and stuff, and they would just be filled with like necrotic,
yeah,
pus,
gotcha.
dead tissue, and
Oh,
they would be so
man.
stinky.
So he wouldn't have to use that?
Heck
Okay.
no. No. Those are situations where you want to use, it's called Dakin's. Yeah, and it comes in different concentrations. Yes, exactly. Okay. So here, I'm going to pat this dry really well. Now, whenever I use silver nitrate, it's kind of hit or miss if people can feel it or, react. A lot of
You mean
people,
like burn?
Yeah, because it is like a cauterization,
Mm-hmm.
but a lot of times people don't even feel a thing. So, see how it goes. I've used it on kiddos too. I had to use it on a 6-year-old recently. I know. She was so sweet. Okay. I always like to protect the skin surrounding wounds with skin prep or just something that I can use.
Like Vaseline?
Vaseline is a good one too. Yeah, I love me some Vaseline. I'm so sorry. I forgot something.
Okay.
Do you mind running out there and asking for a ruler, please?
A ruler?
A ruler.
Just from the,
Yeah, like a ruler that you use to take pictures.
Okay.
Yeah, thank you. She's so nice. Okay. So, I'm just gonna put this all around the wound.
It's like what you used to do when you get a relaxer, put that stuff on your arm. That's
So
gonna
it
burn
won't
your
burn.
forehead. Yeah.
protection.
Yes.
We gotta get your belly button cleaned out, dude.
Which one?
You only got one. It's just, it's moved.
It moved again, didn't it?
Yeah, it did. I'm sure trying to figure out. They was like, you know what? He need his belly button. That's funny to me.
I
They
did
need to try
have
to take it out.
He cares about their belly button too.
Do we? You
Yeah.
care about your belly button, OJ?
So funny. We did have a kiddo here after like a traumatic car wreck, and he had a similar situation going on with his stoma and a midline and everything.
She gave us
You're a
2.
blessing. Thank you so much. And his mom was so happy when the wound was closing in and his belly button was visible again. She was
Oh,
like,
man.
"That's my connection to him," you know. And I was like, "Oh,
It makes sense.
yeah." Okay, so this one, where is it? 15 plus 8.5, so 23.5 centimeters long. So midline, abdomen, thigh. Width is like 1.6, and no depth because we're hypergranulated.
All right, now.
I'm just gonna get
It looked like it was sizzling. Was that my imagination?
sizzle. It's probably for me, like
Did you see it?
kind of.
Like, it did. It looked like it was bubbling.
He might be tooting.
Really?
Start there, boy.
Yeah, you can toot through there.
You be farting?
Sometimes
You be
osteopaths need to be burped
Yeah, cause
too.
they what's her name?
They
Yeah.
would.
That's the one part out that like. Sometimes I be thinking my bag's full and it don't be none but gas.
It's just gas. Yeah. So you will sometimes just need to like open the pouch and kind of give it a little burp it. Yeah.
And make sure you spray afterwards.
I'm dead. It's so funny.
I did order some deodorizing lubricant for your pouch. We do not have deodorizing lubricant here, but I've gotten samples of it and really liked it because you can squirt it in your pouch and it will make what you empty from the pouch easier to come out because it's like a lube. So it just, but it also has deodorizer in it. So
What
I'm
about
hoping-
potpourri?
I would not put poopery into the pouch, but
I'm
around
dead.
in the air for sure.
Yeah.
Yeah,
That is
Just not in the
funny.
mouth.
yeah, just not in the pouch.
They got potpourri right. Yeah, I got potpourri.
All
I
right.
love his stuff. I got one in my purse, one of my purses.
Potpourri?
You ready
Potpourri?
for this?
No, potpourri.
Yeah, you go take it in the bathroom.
Here we go. Just gonna roll that on. And we're gonna calm it down.
Girl, because I can't see. I have to watch this again without my
I'm trying to
glasses.
watch.
You're fine. I'm starting on a small one first. You don't seem to be bothered by it, which is great.
You say it's like a colorization.
Yeah, chemical cauterization,
Gotcha.
silver nitrate. Yeah. And you just roll it on.
So it comes out in that. So that's what how it turns from that to white.
Yes. Yes. And we just need this hypergranulation tissue to chill out. So far, so good.
This is here fast though, ain't it?
You heal fast, boy. I'm telling you.
You're doing great, dude.
Is it burning?
What does it feel like?
None.
Yeah, I've wondered that about
Here, give me that
hypergranulation.
favor.
Like,
Hold
can
this.
people
I'm
just
getting a
not
little bit
feel it?
lightheaded.
Like a
Me
stoma?
too.
Are
I'm standing
you?
up a
Yeah,
little
sit
bit.
down,
I'm like,
please sit
okay.
down.
It's a lot.
Yeah. Yeah, sit, sit,
No, I
sit.
don't think it's sad. I just think I'm hot.
We'll say the hospital's been hot AF lately.
Pass that on.
Girl,
Right?
I'm tired. I took my medication too.
Oh, yes, that'd be having a College 1 code. Damn, I just learned that code.
That's
EMA.
EMA, yeah.
Yeah, emergency medical assistance.
And that's for
Visitors.
visitors and staff if they pass out in here.
Yeah.
So sit your butt
No,
down.
because I done had some times where they come in and they like doing something with him, and it makes me like feel like I'd be like, oh god, I be having to get up. I'm like, please, I feel tingly.
They had an EMA today. That's how I learned that when I was just in
Oh, they
therapy.
had one today.
Yeah.
Yeah.
A visitor?
Either a visitor or a staff, somebody got
Oh,
sick.
no.
Somebody that's not a patient. That's what that means. You know, I ask all the questions.
This little fan, it be working, don't it?
Working our way down.
It cut on.
It didn't work for you?
Not yesterday, and I got to mess with the batteries and everything.
It's working.
Gotta be Dylan. My boss man.
Is he coming around?
He's probably-
coming around.
Yeah. That's probably what they're
I'm gonna cover this up
calling about.
so the nurses don't steal it from us. I ain't
I got
bragging.
another question for you too, though, Maddie.
Mhm.
On them other wounds that I got, I've been having them uncovered since yesterday. Or do I need them covered?
I haven't seen them yet, so let's look at them when we get through all this.
All right, I
Yeah.
think.
How many sticks?
Now I know this one.
Now,
Is this
is it
covered?
one?
Usually there's only 10. I have made a great effort
No,
to
she said
collect
she
them.
was gonna
That's
do
why
that.
I'm like, where are
Alright.
his? Because I need to replace my stock. Yeah.
All right.
I ordered them. Like, what the heck? But it's okay.
I have no
This is
idea.
why we have the stock.
Will he get those as part of his order? Will he need them?
No.
probably
This
won't.
is not something that we.
Do outside the hospital?
You
I mean,
do, but we wouldn't ever ask you guys to do it.
Oh,
You know what I
okay.
mean? Yeah. And I need to ask about like what his definitive plan of care is after this. Like if you're gonna get home health, are we managing it just at home? Are you gonna follow up with the surgeon? Because while this is doing pretty well, yeah, I would love for somebody to keep getting eyes on it as it heals.
I definitely got to follow up with the surgeon because that's who's supposed to let me know if I'm gonna be able to get a reversal.
Mm-hmm.
So what about home health? Have they said anything about that?
Not yet. I got to meet with Amy, I guess.
Yeah, that's your
Hope they
case
do that.
manager.
You need home health probably for a little while.
Probably just one.
Just so the transition.
So that kind of like dries up the rawness, doesn't
Mhm.
Yeah. Yeah.
Man, that's the best thing
It's
since sliced
essentially
bread.
like killing that hypergranulation tissue. It's
That's
saying,
crazy.
get the
Calm
heck
down.
out of
That's
here.
why you said calm down.
Yeah.
We don't need that much.
Yeah. Body's
Man,
just
that's
doing too
amazing.
much.
it? What our bodies produce, and we have to.
Right? Well, and I'll admit, so he came in and had like just a standard normal saline wet to dry for this wound bed ordered, and that is something that a lot of surgeons learn in med school and they just like carry it on. We got a new product called Polymem. It does amazing on like every wound I put it on, but it is a moist dressing, and we put it on him, and hypergranulation tissue loves a moist environment. So when I came back for a follow-up, I was like, okay, we've closed in, but we've also gotten a little too excited, you know? So it did what we wanted to do. We just have to do a little bit of backtracking.
So is wound care your specialty?
It is, yeah.
Man.
Okay. Feel pretty good about that. I think we hit all the areas. Maybe just one more. So glad that you are comfortable. Okay. Cool.
Okay.
We're done with that part.
Get back up. Chad, I need a church fan.
I always take post.
Oh, yeah, Dr. K, one picture.
Girl, don't be scared. Get up on it. That's how I was. I'm over here like about to
Jocelyn
drop the
be
phone
better
in.
pass out.
Are you, Jocelyn?
Look at
I be like,
Oh, it's the love, honey.
it
That's
hurts
all that
me a
is.
little bit. It's
It
like,
does.
It hurt.
It's what that is.
she be doing the
That's
Genesis. You
empathy pain.
Yeah.
remember Genesis the
Oh
first
my
time?
God. My daughter almost passed out. She said, oh, it's getting dark in here.
Yes, that's how we feel. I'm like, okay.
No, literally, we had to hold her up. And mama was crying. She just cried and
Yeah,
cried.
because that's back when Genesis was about to be a nurse.
Yep. She was little. She was young. That was 8 years ago. She's only 20.
I also want to tell you guys, so there is a huge online community of people who like share their experiences with ostomies, and they share tips and tricks. There's a lot of information out there, and people who have ostomies, when they share that stuff online, it's so good. Like it's a great thing for
Girl,
everyone.
I am dizzy, man. Y'all need
Babe, I
some
need you to
water.
sit down. Please
Maybe
sit
I need
down.
food. Here, we got switch.
You got? Is that water bottle full of water?
it is.
Do you mind
That's
if she has
probably
this?
what I need.
Yeah.
Take off your jacket. It's hot.
But I would
Got it.
recommend going and looking at those videos because people with ostomies can speak more clearly to what it is, what life is like with them. And they absolutely know things that I don't know because I've never had a stoma. I just, I play with them, but you guys then go home and I don't know what happens after that. So I would
Is it?
get on, I don't know, Facebook Reels, TikTok,
Yeah.
Instagram.
Yeah, okay.
Yeah, there's videos out there, a bunch of girls, and they're just like, they make it like fun. I love
I've
it.
seen, yeah.
I'm gonna go look.
Yeah.
I mean, I got Calvin.
I love it.
I got Calvin.
How long he been having his?
Calvin been having his ostomy for about 4 years now.
There you go. Good.
That's his friend.
Yeah, good. Okay, let me show you guys crusting real quick. We're not going to crust on him because he doesn't have any open skin. If he had open skin around his stoma, we would crust.
And you mean, when you say around it, you mean like immediately around it?
Immediately around it.
Okay.
Yeah. Because this stoma creates a moist environment. That moisture can lead to skin breakdown, okay? When we crust, what we're trying to do is just protect the newly opened skin from any additional moisture so that it can heal on its own, okay? I can't say that like the crusting itself really delivers any specific therapy to open areas around a stoma, but I know that it protects that open
the
skin.
skeleton close.
Yeah, and then your body can heal it. you
So
know?
what is it like? Is it
So what you would do,
drying or is it?
this is stoma powder, which
Oh,
I ordered this for
okay.
you too, okay? If there were open skin, we would do a light dusting of it all around the stoma.
Okay.
Yeah, and honestly, let me just take my glove off and do this way.
Oh, that's what's the name? She was on the phone with you too the other day. Simonia, when she was
Oh
in
yeah,
here panicking.
Simonia. Yeah, I know.
Simonia was panicking like me.
Why was you panicking?
Cause it opened up, it
Yeah.
busted in the middle of the night.
So light dusting with the stoma powder directly around the stoma. The powder will attach to any open skin, okay? The rest of it, you can kind of just like gently pat around, okay? Wipe away any excess, and then take skin prep, which there are various forms of skin prep, okay? The one that I ordered for you is a Coloplast brand. I think it's called a skin protectant. Hey girl. So
Hey now.
you would take the skin prep and you would dab directly into the stoma powder. Just little dabs, not a swipe, but just little dabs.
So does it get hard? Oh, okay.
And that keeps the moisture from it.
Yep, it protects any open areas. But we don't want to do this if the skin is clean.
Okay.
Yeah, because I have seen it like contribute to breakdown because
Yeah.
I was using it unnecessarily, like very early on, So when I scratch it now,
Oh, okay.
like
Can I feel it?
yeah,
Like a little.
Yeah, like
feel it. Creates a little crust.
I can see it that it's crusted. It looks
I
like,
ain't really wanna
it
feel
looks like
but I
crazy
guess.
glue. Yeah.
It's a crust.
It looks like crazy glue.
It does
sound
sound
like
crazy glue.
After cleansing the stoma, that's your first step if you had skin breakdown. Okay? You would crust.
Make sure you're getting a good picture.
Do you want to see the crusty?
Your crusty hand.
Yeah.
Yep, it's like crazy glue.
Yeah.
Like excess.
Yeah.
When I try to glue my thing on the back on the side of my glasses.
Stacy, do you need to do something?
No,
Are you sure?
Yeah, I was just gonna show them how to do this when you're done.
Okay, so next step, what you will always use. I firmly believe in barrier rings. This is our protection for the skin around the stoma. Not to say that skin breakdown can't still happen, right? But this is how we can help prevent it, right? So, and there's tons of different types of barrier rings too. You're gonna get a Coloplast.
Do you got favorite?
I like this Econ one. I
And
do.
is that,
Yeah.
is that like the other one where you can either just put it on or you can kind of tear it apart and then, all right, cool.
Yep, that's exactly it. Because we use it for a bunch of other stuff too. Sometimes just to fill in
And you
the
smushing it?
gaps.
It's smushy?
So I'm gently
Stretching
stretching
it.
it.
Ah.
Yeah.
You
Don't
can
go
even break it
crazy.
in half.
Don't
Not
like
half,
stretch
but
it
like-
hard at first, because if it gets too big, it's really hard to bring it back
Close
in.
it back.
And you don't want it necessarily choking the stoma, you know, but you want it pretty snug on there. So like I'm gonna attempt like a hooking situation. I'm gonna come around.
Ah, okay. I see what you did there.
Yep.
You just do it enough to where it goes around the base.
Dun da da dun. Mm-hmm. Just like that. Yep. I will say, so the skin barrier that I ordered for you from Coloplast, that skin barrier you can use all around your stoma prior to the barrier ring, okay?
Okay, yep.
Because it's
Can
the
I
same
look,
product as the Coloplast pouch, it doesn't
I just,
impact
yes, ma'am. I
adhesion.
just want to touch it around
This
it
impacts
because you do it.
adhesion. So use that skin
Thank you.
barrier that comes from Coloplast. I would wipe that around your skin
Cool.
and then put the barrier ring on. Okay.
So it can hold more.
Yeah,
I'm
yeah. I'm not doing that with our
Because
skin
is
prep.
that one of the things that could be a reason why the bag could come off? Or
Lack of adhesion.
okay.
Yeah, and then if like the bag
So this
is
is sticky on both sides.
And you know what?
Hmm.
I meant to say something about that. I that's probably why it came up for yesterday, because yesterday they forgot to use the baby wipes,
okay.
the warm baby wipe
Yeah.
trick.
Yeah, we'll do that.
Okay.
Also, if
It's
the
a
bag
hack.
gets like too full of poo, that
It'll
creates
drag it down.
tension. Yeah, and then gravity it'll come off.
It'll
So
pull.
try to stay on top of that. When the bag is about, or the pouch is about a third of the way full, is when you want to empty it.
That's what I was wanting to know.
Yeah.
How
full
full?
does it have to get?
About a
So how
third
many
of the way.
times a day do you do it?
Depends on how much he's eating.
Oh, okay.
You know?
And sometimes you gotta burn it.
Yeah.
Yeah,
Yep.
it's just with air.
That's what she said earlier, birthday.
Yeah.
So we're gonna get to cutting the pouch, okay? So this is his one peach pouch, this flip that he likes, okay? A lot of times we'll use these flip pouches on people who have like big folds in their abdomen that we want to accommodate. Like people are a little bit heavier than you are, but it just happens to work on him. Like this would have not been my first choice pouch, but I saw the ostomy nurse at U of L recommended it. They just didn't have it on stock. So when you got here and I realized that we did have it in stock, which is so rare that we have something U of L doesn't have, I was like, well, let's give it a try. And sure enough,
That's
you
the end of
know,
my life.
yeah,
This is,
yeah. So this is the Flip Neo.
what's it called?
Yeah, convex flip Neo. Okay, but I sent all this to
Okay,
Jeanette, yeah,
okay.
like all that. She has all of the information. Okay, so I'm gonna start out small when I cut. Okay, I just put my scissors in there. I think I'm gonna go to 30. All right,
What does it say, 30?
right there.
Ah, okay,
Yeah.
okay.
Because I
see
used to
that
be a
one.
41.
Yeah,
It's starting to shrink.
yeah, and then I just work my way around. And I bet you the 30 is gonna be a little bit too small, but I would rather start small and work my way out.
Because once you cut it, you can't uncut it.
Yeah, but if you do happen to cut a little bit too large, if you have the barrier ring in place, that's your fill-in.
Mm-hmm.
So that's why I'm always like, use the barrier ring.
It seems like it's a given.
Yeah, I've met some
People
wounded
try to
ostomy
get past
nurses
it.
who don't use barrier rings, and I'm like, y'all are crazy. Y'all are crazy.
Thank you.
I also always smooth the edges with my fingers.
Okay.
Be nice to your stoma. It doesn't want to be stabbed.
Yeah.
Okay. Okay, we'll just see. Okay, yeah, way too small.
Okay.
So we're gonna go out a little bit more.
And how could you tell it was too small? Just from looking through the inside? You can
Yeah,
kind of see
that
it?
window.
Ah, okay, because you
Yep.
can see through the other side. It's clear.
Yep.
Yeah, like if you kind of stuff your pinky, like if I,
Yeah, right there. You can see
yeah,
through that side.
like if I kind of stick my pinky in there, you can kind of see the stone, you know?
Yeah.
So,
So we're gonna keep cutting around.
How much further did you go?
I just went to the one,
The
next
like
one?
middle line,
Okay.
yeah. So now we'll be at like 35.
Ah, okay, the little dotted line.
And now if you get the samples from the other companies, unfortunately, they do not have a standard measuring thing. You know, like
Don't you hate that?
yes, I do. I
Don't you
sure
hate
do.
that? I mean, let's keep it
similar,
standard.
but they're not the same. So, you know, eye or stoma. Okay, even the 35 seems actually.
A little bigger.
Is it going all the way down to meet the ring?
Yeah, I think
Okay.
we're actually good at the 35. 35
Okay.
might be your new spot. And I usually try to like hook from the bottom and then set it on top. One thing I want to add, so when he's at home and we're emptying our pouch, probably a good idea to put our pouch up and down because then you can lean over the toilet and empty it. In the hospital, while you have staff and people helping you, it's good off to the side because you're gonna be laying in bed and then they can put like a little container here and it empties out, you know? So just wanted to add that little piece.
So you empty it and keep it on, you don't take it off and change it?
No,
Nah, you
yeah,
empty
if we
it.
did that, we would like rip at the
Run out,
skin,
yeah.
all,
I had
yeah.
no
You
idea.
empty it right there. That's where it's gonna seal up at the bottom, right?
Ah, okay.
Because
Yeah.
you're gonna end up folding it up and
Yes.
then linking it, bam,
So
bam.
it's this whole thing.
That's also where you burp it.
Now, there are the deodorizing drops and things. People will put these in before they put the pouch on. Sometimes I put it in like once the pouch is already on, but we'll do it before. So, and because especially since you're getting the lubricating deodorizer, it'll be a good idea to do it before getting the pouch on. So, for closing these pouches, this one, it has Velcro. So, if you want to empty it, you just fold it back, and then this like hard plastic piece, you know, empties or opens that way, and then you can wipe the inside after you're done emptying the pouch. You see? Okay.
Fold it backwards.
Yep. And then you want to fold it.
Yeah, because,
Yeah.
Yeah, that's kind of like where it is right there.
But
okay.
Fold this piece back, connected to that Velcro,
Mm-hmm.
and now you have like a clean opening. Yeah. So with that piece folded back, you want to fold it up towards him. One,
Towards
two times. So it's 3 folds. Okay.
Ah,
Just you
my
can
bad.
do. So 1 fold back, and then 1, 2, and there's more Velcro. You take these tabs
And close.
and close it. Don't forget to close it.
Yeah, don't forget, yeah.
Because I have even forgotten to close it. It's just something that happens when you do it so often.
Yeah.
You
No,
know?
don't forget
Yeah.
to close it.
So close it and then
Coming
put your
back towards
lubricating
the clear
deodorizer
side.
in.
That's why I
This we
remember
don't
that.
have lubricating deodorizer on site, so I'm gonna be using these deodorizing drops. Okay.
Uh-huh.
And I think the Hollister, they recommend anywhere from like 9 to 15 drops. It's a weird number, so I just kind of like put it in there.
Is it color? It's colored?
It's blue, yeah. Couldn't tell you why, I'm sorry. But it's blue. Okay. And now we can take this. And I'm gonna come from my bottom edge.
That look very secure.
Yeah, but you know what I did? That's stupid, and I hate that it's on video. I'm so sorry.
No.
There's a plastic piece. I'm sorry.
It's okay.
It was just for practice.
That
right
was
now.
good.
That was just
good.
practice. It was practice. So your hydrocolloid, there it is.
Okay.
You know, and give that like
Yeah.
a feel. You feel how light it is?
Mhm.
Yeah, that's why
With
I
the
have
little
trouble
blue
staying
edge.
sometimes. Give that a
Okay.
feel.
We can,
I feel like those cushions that you put
And
on
that's
like your
why we
shoes.
do the what's the name hack with
Yeah.
the
Sticky
warm-
to sticky.
Yes. Okay. One more time. So I'm hooking from the bottom, kind of bringing it all around the stoma.
It don't hurt.
And then I like to
That
kind of
is
like
crazy.
press into it around the edges so that it molds with that barrier ring we put down. And honestly, sometimes I even will like get my hand in there if I can do this cleanly. I don't know.
so that you can press around on the inside. Mm-hmm.
Just so it's nice and adhered in there.
Hmm.
Okay. Yeah. Cool.
Oh, that look good.
Like it's
Yeah,
in
good
there.
job. Yeah,
In there, yeah.
that's crazy.
So, next part.
I don't know why I thought it was a tube that came out.
This. There's, I mean, he's got other tubes, so you get, you know.
Learn stuff.
You know.
We learn something new every day. This is crazy.
So I am gonna trim it just a little bit because he's got this big midline wound, right? And it's, you see how it overlaps?
Mhm.
Yeah. So we're just gonna trim just a whittle.
Would you?
And then for him, since we have had, what, 2 weeks now? Yeah. We're gonna use these barrier extenders, okay? They're not exactly made for this pouch, because this pouch has these like wavy edges, but I've found them to still be effective. Yeah. And they just add,
extenders,
it's extenders, it just adds extra reinforcement.
so it don't pop out.
Or we have at least a better chance of it not popping off. Yeah. Like I said, I do anticipate some like troubleshooting. You know, like you'll get home and figure out what works best for you guys. Call the companies, ask for more samples. They will send them. Jeanette is awesome. She's told me before that
It
she's
looked
like
like
made house
skin,
calls and things.
kinda.
So anything you need, she is very, very good about that. So I'm just adding these to the outer edge. And I've noticed that a lot of pouches, if they're gonna pop like at the lower end of the pouch.
Because
So
it gets heavier.
I
right
think,
there.
yes, yeah. So that's where I start with my extenders. And then we'll put,
I bet you they got all kinds of different tricks online.
yes, and that's
YouTube.
like I
When I
said,
go
things
to-
that
when I
I
go
don't
home,
know,
yeah.
you know, so
When I go home, I'm
always-
gonna go on TikTok.
Yes.
Yeah, TikTok, YouTube are always great.
TikTok, honey.
I
You know,
always
TikTok will
encourage
teach
my
you
patients
everything.
And
to
you've got real
watch
people
videos
doing
online
it
of
too.
people
You
who
know,
Yeah.
it's like,
have
okay, this is
stomas.
what they showed me in the hospital, but this doesn't work when you get home. You know, that kind
Yeah.
of thing.
Because you gotta be able to reinforce it for real life.
There are
And you putting it all the way close up to the pouch, as
Well,
far as you can get it, just on the.
just on this edge, since his abdominal wound is right there. On this edge,
But this side, it going closer to that as you
this
can
is side, I'm going as close as I can
get. Okay.
to try and not interconnect with that. Okay.
That was real smart. What about those liquid adhesives that's like, if you have
Yes.
if you have a like I don't have it on today, but I got a Dexcom 7 and they make the little skin stuff that you can squirt around it and
Yes.
go like that.
You can use those. I left some Mastisol at his bedside for if we needed to. Mastisol is liquid adhesive, like on steroids. You wouldn't normally use it. I mean, I know
What's it
people,
called?
Mastisol.
Master salt.
It's not specifically made for ostomies. I have heard of some wound nurses using it to help with adhesion. It is,
Harder to get off though.
and I think it can be a little rough on the skin. You
Cause
know?
issues.
Yeah, so
Maybe just special occasions.
Exactly. So I left you a couple in your room just because, you know, going to the gym, moving around, sweating, those are all factors that will contribute to this not staying. And I didn't want you to be like in a situation where you're in the gym, I'm not available, and nobody can figure out how to get it to stick back down.
Right.
So I wanted the Mastisol at bedside as like your breakout kit, you know?
Right.
Now, the last thing I'm gonna do, and he knows about this, we're gonna put some warmed bath wipes all around it, just the packages, to mimic that at home. And I'm gonna say this very, with some reserve, because we wouldn't normally recommend something like this. But I have had patients who have used a hair dryer.
I knew you was gonna say it
Yeah.
because I was thinking it.
Yep, like on a low warm setting and just all around it, and then add some pressure with your hands, okay? Or you can even microwave a dry washcloth and get
Or what
it
about like a
warm.
heating pad?
A heating pad? Yes, definitely. All
Maybe I
those
would
things can
blow
help.
dry the crap
But-
out of it.
Yeah,
I wouldn't do it that bad.
with the
Just a
blow
little
Just
bit.
a little
dryer,
I wanted to
and
melt to him and not be able to get it back out. Just
with
a
both
little bit.
with both the blow dryer and the heating pads and any sort of like heat that you're adding, you got to be so careful about burns. They happen like that.
So you talking to the actual snowman?
To the
Skin around it, 'cause- yeah, 'cause it's
yeah.
light.
So
Yeah, I can see
listen to him. Like if you're gonna do that, make sure that you are listening to your body's cues. Like if it hurts, if it's too hot,
Say it's too hot.
Right.
Don't say I'm
Full stop.
okay.
you know, yeah, exactly.
You know how
Yeah.
me and dude they be like, I'm fine.
I'm
Chips on
fine, all is
dumpster
well.
fire.
I know, right? So let me go and grab. I'm gonna get the packages of warm bath wipes, and then I also wanted to grab something to put on this so we can get it covered up, okay?
All right.
Because now that we've done the silver nitrate to all that hypergranulation tissue, we'll put a temporary dressing on just for the next like 12 to 24 hours, and then we can go back to the standard
normal,
dressing.
yeah.
Yeah. We just want to, now that we've like freshly cauterized that skin, we want to be real gentle with it. So I'm going to go get something, it's called a hydrogel, something that can offer a little bit of moisture love to it just to support it, okay? So I'll be back, and I promise I'll clean up all my stiffs. Yeah.
Hey, we so did learn a lot today, didn't we?
Yeah, and I left him with an informational book that he has told me he's read, and he looks away. Is that true? Have you read
I have,
it?
yeah.
He's a reader.
Okay, good. I was like,
He probably read as soon as you left.
I was
He's
like,
a reader.
read this. Okay, I'll be right back.
This is crazy.
It's kind of living life with a poop bag. Nah,
Is it?
nah, it ain't with
I'm Stacy. I work with Dr. Kaylin.